Hello everyone, I am Dr. Anil Kamath. So one common symptom which we come across very frequently in our outpatient clinic are nodes in the neck. So patients come to us telling that they are feeling something like a swelling in the neck. So what are these and what tests are to be done? Let me talk to you all about all these aspects. So most of the time these nodes are what we call lymph nodes. We must remember that every person will have lymph nodes throughout the body. The lymph nodes belong to the immunological system and are responsible for immunity of the body. Of course, as person grows and the immune system develops, these have become less important. But the lymph nodes still react to wherever an infection or cancer happens. Say a person has an infection in the mouth or teeth, the lymph nodes get enlarged. The draining lymph nodes get enlarged to fight that infection. So this is the most common reason why lymph nodes get enlarged. The infection might have already been dealt with, but the lymph nodes continue to persist. This we call as reactive lymphadenitis because the lymph nodes are reacting to some infection. It's a totally harmless condition and nothing needs to be done for that. We don't even bother to investigate this when we are suspecting reactive lymphadenitis. But it would be wrong to mistake every lymph node enlargement as reactive lymphadenitis because you can miss out other more serious conditions. So what are these conditions? First, we have tuberculosis, which is a very common condition in India, and a patient may have no symptoms, no cough, no fever, and yet have tuberculosis lymph node involvement in the neck. The next is cancer. There are other conditions like sarcoidosis in which the lymph nodes get enlarged, but the condition we are bothered about is cancers. When we talk of cancers, there are two types. One may be actual lymph nodal cancer, what we call as lymphoma. In this case, not only the lymph nodes in the neck, the other lymph nodes in the armpit or in the groin region might be enlarged. Then we have lymph nodes where the actual primary is somewhere else. It might be somewhere in the oral cavity or oropharyngeal region or the voice box or in the thyroid, and these lymph nodes may be because of spread of a cancer from that primary to these lymph nodes. So these are all the reasons why the lymph nodes get enlarged. Reactive lymphadenitis, tuberculosis, other conditions like sarcoidosis, lymphomas, and as main cancer being elsewhere and this cancer spreading to lymph nodes. So how do we evaluate? First, we do a detailed clinical examination where we examine the oral cavity and other draining areas. We examine the other lymph nodal groups in the armpit and in the groin. We examine the chest and abdomen, and based on the clinical suspicion, we order further tests. We may ask for a FNAC or fine needle aspiration cytology, where we aspirate a small amount of material from the lymph node and send it to the pathologist to see what it is. When lymphoma is suspected, fine needle cytology will not be adequate and we may have to plan removal of the entire lymph node. For tuberculosis, there are various tests like gene expert and other things. So broadly, this is how lymph nodes enlargement in the neck is evaluated. So you need not panic as most of these conditions are harmless, but if something of this sort is there, it is better you meet a medical professional to rule out more serious conditions. Thank you.